Hey there, my name is Megan Clanahan. I am the co-owner of Houston Moms Club. You've seen me here a few times before, and you've also seen this amazing woman to my left or right, depending upon how you're watching this. And this is Dr. Juliette Breeze with Next Level Urgent Care. And she has been with us several times this year as we are all navigating this quote unquote new normal, which I know we're all a little tired of hearing that phrase, but it's still accurate and applicable. And we are so thankful she could join us to tell us her thoughts on what is happening here lately, as well as the new developments at Next Level Urgent Care since we last spoke. I think it was a town hall that we had, and there was great information shared that was applicable then. Like everything else, this is kind of a revolving information, spend. So we need to know the latest and greatest. So she is here to share all of that with us. Dr. Breeze, thank you so much for coming back and joining us.
Thank you so much for having me, Megan, and thanks and hi to all the moms out there. We're all in the same boat here, just trying to ride the COVID waves as they come at us. So I appreciate you having me to tell you about the latest and greatest in the pandemic world.
In the pandemic world, can you even, you just need to hashtag that. It's just, we were chatting earlier, and Dr. Breeze just very much echoed the sentiment that we're just so ready to not have to talk about this. But until we get to that point, we really, really want to help keep you as parents and as moms informed as best as possible for various options that are happening. So Dr. Breeze, tell us about a little what you guys are doing at Next Level Urgent Care in the way of COVID testing. Because I think what we found, especially as schools have gotten ramped back up and kids are back in, and then they're being sent home because there might be a stomach ache or a little runny nose or congestion. And then we have to have the COVID test to go back to school, or the 10-day quarantine, and I know the rules are different for every school district. So how are you meeting the needs of all of those kids that are now being sent home, or parents being sent home from work? So what's happening in Next Level?
Megan, that's such a loaded question. I'm not sure if we're, fully meeting the needs, because the needs are changing every single minute. And so it's very hard to keep up. Basically, depending on the school and depending on the school district, sometimes there are different tests that are accepted as proof of COVID negative. And so we have to be really careful when we're seeing the kids out there, because some schools are accepting rapid COVID tests and some schools are insisting on PCR. And so that's a very big thing. So, for the moms, make sure you know what you're supposed to get. We've definitely had some incidences where people were unhappy because they realized too late that they have to get another test because the test that they got wasn't right. But I'll tell you a little bit about what's sort of evolving here at Next Level. When I talked to you last time, we had a couple of different options for tests. We had the rapid antigen test that we were just launching when we started talking, and that's been going really well. The rapid test takes about 15 minutes for us to get an answer. And we've found that it is a very, very sensitive and accurate test for the most part. Now, where it fails is when we have a kid, or a parent for that matter, but I'm going to gear this toward kids. If we have a kid that has symptoms and we do a rapid test and it's negative, we might recommend to the mom, let's go ahead and get the PCR just in case, because when the rapid test is not good is when it can. When it's positive, it's positive. If I tell you your kid has COVID off of a rapid test, then they have COVID. But if it's negative, there's a slight chance, like a 2% chance, that they actually have it, and it's just early, it's not picking it up. And so that's where PCR comes in as a better alternative, because it can really find teeny tiny viral particles, and it's a lot more sensitive than the rapid test. But we found that the rapid test for the most part is really, really helpful. And we only recommend PCR follow-up when we feel like, this person's probably got COVID. So that's rapid.
Okay.
The next one is PCR, the regular old nasal swab, and y'all, that's the one everyone's been doing since the beginning. It is it's what we call the gold standard. It's the one that is the most accurate of all. But now, as of last week, we have a new alternative, which is pretty exciting for moms, because it had been until last week that we had to use a nasal swab to get that PCR sample. And this new lab and new testing that we're doing right now allows us to get a saliva sample. And so no more sticking things up kids' noses. We were laughing because one of our jokes is that kids love to stick things up their noses unless it's a nasal swab. So then they're not so happy about that. But anyway, so the saliva test is exciting in that it's actually a teeny fraction more accurate than even the PCR, the nasal swab PCR. They've found that that you can detect even a smaller viral load in the saliva sample than you can in the nasal sample. So it's a great choice for non-traumatic COVID testing. The downside is that you get your answer between 1 and 3 days after the test. So, if you're like me, I want to know now, I want to know right away. And so a lot of people are going for the rapids, but I think, if you're concerned about your child and traumatizing them with a nasal swab, then that's a fantastic way to go. And it's, right now we're only doing that in our Tanglewood location, but on Monday, November 23rd, it will be available in many of our locations. So, right now it's still limited in quantity because there aren't that many labs doing that one. You had a question, Megan.
No, I was just going to say, I'm so glad you said that from the rollout standpoint. So,
yes.
Because my kiddo got one on Monday.
Oh.
And they're like, oh, it's only at Tanglewood. And I was like, I love you, son. We live in Katy, for y'all who don't know. And I was like, you're just going to have to, but I had to laugh because we know that kids just like, they'll stick peas,
whatever. We dig a lot of things out of kids' noses, but they're not happy when we're coming at them with the Q-tips. So, I
will say you guys have done an amazing job because I've had it once at your place. My son has had it twice and my daughter has had one. Y'all have perfected the art. So really, it's not, everyone is like, it's not that bad. It's like, it truly isn't. It just sounds worse than it is. And your staff does an excellent job, especially of getting the kids to kind of just chill, lean back, and,
that is very kind. I'm so happy you said that because, the last thing we want to do is hurt a child or make them afraid to go to the doctor because that's not what we're about. But, who knew we would ever have to perfect the art of doing a nasal swab? That's just sad. But anyway, so the other things I was going to tell you about, we have some other tests that are a little bit new for us. One is when we talked last, I told you that we had an antibody test that we had to draw blood and send it to a lab. And that the reason we were doing that test was it was more accurate than the finger stick tests that had come out initially. The finger stick tests were a great conceptual idea, but they weren't very accurate at all. So luckily, scientists have continued to work at that, and they have finally found one that really does seem to be very accurate. It's still, none of this stuff is 100%, not even the PCR is 100%, but we're getting closer on things. So the antibody test that we have now is a finger stick antibody test. I still am not a huge fan. I don't recommend the antibody test to anyone, but I think we were talking earlier that occasionally a person will come in and they'll say, I wasn't feeling that well a couple of weeks ago. And I didn't think anything of it. But now I just talked to a friend that I was with, and apparently everyone I was with had COVID. And they want to know, well, did I have it? And so that's the perfect scenario for doing like a finger stick, where we can say, looks like you do actually have antibodies now. So several weeks ago when you were exposed, you probably did have a mild case of COVID-19. And, we're still a little bit hesitant to tell people, well, you're immune, no worries. But I do have to say that um, having had COVID and having antibodies is definitely better than not having antibodies. And so, it might not help, but it's certainly not going to be the worst. And so, for the people who want to know about that, we have that test also now. And that's going to start actually also on November 23rd. Everything that we're doing is starting next Monday, because we have all this equipment that we have to roll in and get everything going. But we're really excited about these new tests. And then the final test that I think personally is very important to offer, even, it's not the right test for every single person, but we have a test called BioFire. And what BioFire does is it looks at a panel of, I think it's 22 different viruses and bacterias, and plus COVID. And so if you come in and you have the symptoms like nasal discharge and things like that, and you want to know, what do I have? Right now, we've been telling everybody, you have COVID or you don't have COVID. But if you're not satisfied with that and you say, okay, fine, I don't have COVID, but what's causing this? That's what you use BioFire for. So BioFire will give us the whole panel and will allow us to tell you, whether you have some other type of virus or whether you have a bacteria. And it also helps guide us on whether you need antibiotics or whether you don't need antibiotics. So those are the big new things that are happening at Next Level.
I love it so much. And I think what I appreciate about your business and what you guys are doing is y'all are staying on top of all of this research. And like we've talked about, I mean, this has just been ongoing. And as we learn, we pivot and we do. And you all seem to be doing an excellent job with being able to offer the Houston community the best of what we know right now. And
it's a big responsibility, Megan, because I will tell you, there's a lot of news out there, and some of it is right and some of it is not right. And we're trying really hard to make sure that when we decide to put a test out there, or we decide like we're looking toward vaccine, we're looking toward treatment, if we decide to put it out, then we feel very confident that we have done a thorough research job and make sure that we're not giving our patients something that is not up to standard. And so yeah, it's scary though. There's I get calls every single day with people who want to show me some new thing, and I have a lot. It gives me a lot of reading.
And I'm sure you guys have a team of really thoughtful things that have to go into place before you institute it into, because we're at how many locations now? Because I did just see Falcon Landing and Katy open this week, right?
We opened yesterday. We opened with a bang. We had like over 70 patients come in the doors. And I think, of course, I do have to say, this is it's just a tough time. We're definitely entering another surge. I'm hoping that all the moms that are watching today are really being very thoughtful and careful about how they're going to do Thanksgiving next week, because boy, oh boy, it is really heating up right now. We are seeing a lot more positives. We're seeing a lot of people come in concerned that they have COVID. So that's really, it's disappointing for us. We were hoping that we were going to kind of just eke out the rest of the year and then get a vaccine and be done. But it looks like we're going to have one more round of a lot of COVID before this is over. So, so back to your question though, Falcon Landing is number 16. And so, yeah, so that's now we're up to 16.
Huge responsibility, what you all do. One more question for you, because I could probably sit here and ask you questions all day, but I am hoping we're going to come back to you in December.
Please.
When we have survived well, I hate to see you, when we've gotten through
Yes.
Thanksgiving, and I'm so glad you brought up that point because I think that's weighing heavily on a lot of us is, what are we actually doing? And so I think that's sage advice for sure. So I guess your Reader's Digest version on what you're hearing from a vaccination standpoint and kind of, your thoughts on that. And then
So Reader's Digest version, I think everybody in the whole country knows that the vaccine trials have been very effective because that's been front page news that Pfizer and BioNTech both have vaccines that are above 94% effective in these phase 3 trials that they've done. That's very exciting. It's especially exciting because obviously without a vaccine, we're just, we're kind of in for this continued thing. So we're really, as healthcare providers ourselves, we have signed up to, we're trying to be a vaccine distributor. We want to be able to get out in our community and help get people vaccinated. People ask me all the time, would I take the vaccine? And the answer is yes, I would take the vaccine. I think that the whole world is watching, and these companies that have these vaccines are not going to put their companies at risk over this. I mean, they're really everything rides on this. If it doesn't work, it's more than just the FDA. It's like, it's a huge deal. So there's been a lot of scrutiny, a lot of great science. It's honestly, the scientific community should be incredibly proud of the fact that we were able to develop and produce something like this so quickly. Really excited to see how things go. I think the thing that worries me the most is distribution. It worries me that the people who need it the most should get it, get it as soon as possible. That definitely means, of course, the older and sicker of us, and the frontline workers. So those are the, the things that still have not been determined, to be quite honest with you. I've been in conversations with the health departments. There's not a really solid plan yet on how that's going to go. And so if we talk again, I hope I'll be able to give you more information.
I love that. And it is so very encouraging. And we get all very excited, but then we have to think about the roadmaps that aren't built yet. Mm-hmm. All the service lanes. And I think that's what's been so fascinating and frustrating about 2021 or 2020. Not even 20. We're not going to talk about 2020.
Yeah, don't go there.
No. About 2020 is we're all kind of just building this new structure, if you will. And I think it is the exciting part is it's an infrastructure that hopefully continues.
That's right.
On.
Mm-hmm.
So it's just building something that looks a little different right now, but the innovation that comes out of the researchers and the people who are going to eventually distribute the vaccine, the people who are taking care of those like you affected by COVID and diagnosing that and giving them the instructions. Y'all are building that roadmap. And so we are grateful, we are thankful, and we are going to come back to you in December because I feel like things are going to change by then again.
Absolutely. And every day, there's not a day that goes by that I don't think that we're changing something. So yeah, I'm always happy to talk to you. And I really appreciate the opportunity to get the information out to moms. I think, all of us are worried about our kids. We want our children to be safe. And so, if there's questions, we're actually coming up with some new infographics to help people with all these testing options because it gets a little bit confusing. So check on our website. In a few days, we should have some more information up.
And we will definitely share it as well as one of our resources below and then on our website too. So Dr. Breeze, thank you so much for spending time with me this afternoon. And fingers crossed when I see you in December. We have gotten through Thanksgiving and we will have some more news to report. But I appreciate you. Stay safe and happy Thanksgiving and eat some good turkey.
You too.
Bye.